Hello everyone, welcome to the CTV News on Calabash TV and on the Wave Radio 94.5. I am Lisa Joseph. As Martinique settles itself as an associate member of the OACS, plans for its role as perhaps the mecca of healthcare in the sub-region are taking shape with regulation in the lead. The French Department and the government of St. Lucia through the Ministry of Health are hammering out a memorandum of understanding, an MOU, on the accessing of health services in Martinique by St. Lucians. This, once signed, will be a game changer for both territories. For decades, St. Lucians have been seeking medical care in the French Isle, and for years that government has been saddled with unpaid hospital bills. This MOU will seek to remedy this anomaly. A French delegation led by the ambassador to the OACS toured the new Owen King EU hospital with officials of the Ministry of Health. The delegation was interested in a first-hand view of works done by the hospital, given that France contributes some 20% of the European budget. The new hospital is being constructed at a cost of 130 million EC dollars, that's equivalent to 36.5 million euros, as part of a grant aid provided by the EU. It is the single largest project undertaken by the EU in the Eastern Caribbean. Because of this major investment in the local health sector, the thrust is to get St. Lucians to be more receptive to receiving care at home first before seeking out services in Martinique, as is customary.
How St. Lucians can go through, especially the Ministry of Health doing that referral on behalf of the people of St. Lucia. But it will go further, and it will involve the council, insurance council, the private citizens who want to access care all on their own, what it entails, because we know that there are millions of euros that St. Lucians have built up in the health system for over years. And we want to see that now that we are building a more, I think, efficient health system for the people of St. Lucia with the new national hospital, which the French authorities have contributed over 20-something million percent, 20% or more towards this institution. We want St. Lucians to realize now that we have a system here where they can access the best care. And if it's not available, there is a way that the ministry will facilitate on their behalf. But we want to know that the first point is this new national hospital, the Owen King Hospital in St. Lucia.
Minister Reynolds says once signed, the MOU will facilitate training for medical professionals. Also, assistance will be given in the commissioning of the new hospital.
As we look at radiology, as we look at security, health safety, as it looks at research, medical research, building capacity in management of hospitals and health facilities, there is so much more that's on the table that the French authorities are offering the health officials in St. Lucia. So today it's a wonderful day. We can't wait for that day that we will sign this MOU. And more than that, I think, is the opportunity for the health officials, health authorities to lead us and help us in the commissioning of the new national hospital. This is a new area for us, and we have to do this right. We have to succeed in management of this hospital throughout the years, and a good beginning makes a good ending. And so the authorities and us, we are discussing how can they help us, how can they hold our hands and guide us through this kind of commissioning phase, that at the end of the day we are strengthened and we know what is expected of us, how can we deliver the best service, but also how can we deal with the staff, how can we deal with the public, how can we deal with health promotion, all of it, to ensure that we have a very successful new national hospital as well as a medical complex.
The French ambassador to the OACS describes the pending agreement as important to Martinique, not just for the regulation of patients, but for the exchange of knowledge between the two countries.
We organize on this agreement all the way that the patient that go to Martinique, it will be something organization by the Minister of Health, which was not the same before. Before, the patient came to France like that, you know, and it's no good. So like that we are going to organize the welcoming of patients from St. Lucia in Martinique, according, of course, to insurances that they could pay, or the Ministry of Health will be a grantee, or insurance company for private, coming from private hospital and so on. But I want to say that it is also a very important agreement for training and cooperation between our two countries, because we are very close to Martinique, and it's good that you can take benefit of the medicine doctors and professors coming from Martinique, from the hospital, university hospital. They can come here and make missions and teaching and welcoming also in Martinique professor or medicine doctors coming in Martinique to improve very important specialties, difficult specialties. So it's a cooperation agreement also. It's not only an agreement for welcoming patient and pay. It's also an agreement on cooperation.
And no firm date has been set for the commissioning of the Owen King EU National Hospital.